Hello, sir. Good morning.
Good morning. May I know who is speaking?
Sir, I'm Dr. Rivu Basu.
Oh, yes, Dr. Rivabasu. How are you?
I'm doing fine, sir. Okay.
Okay. So how are things going on?
Yes, it's fine now, but we are working with a lot of constraints. That's it. Okay.
Okay. But I guess you are joining this session 3 times. This is your third time,
Uh,
isn't that? So
yes,
then I
sir.
will ask you a lot of questions then.
Like, okay, sir. Okay, okay.
Hmm? So you are well experienced. So I was wondering when I
Not
saw your name in the list. Hmm?
okay, sir. Okay, okay.
So you have already taken a similar session in Kolkata, I remember last time.
Yes, yes, sir. Yes. Still, like discussion another time in online mode will help me. Okay, to gain some more.
Exactly. We would like to get something from your experiences as well, right?
Okay, sir. Okay, sir.
Hmm. Thanks for joining, Dr. Revan.
Thank you, sir. Thank you, sir.
Thank you.
So, shall we start or shall we wait further?
Let Abhishek decide. I will start whenever you give me green signal. That's it.
We'll start at 10:10. 3 more minutes.
Okay, sir.
I'll quickly give a call to Mandla sir to check if he's joining.
Sure.
Mahendra sir has already joined.
Sir is here. Yes.
sir. Yeah.
Somehow I missed his name. Yeah. Good morning, sir.
Good morning, sir.
Good morning, sir.
Where is sir? I'm not able to see sir.
He has not
Good
switched on
morning.
his camera, sir.
Okay.
I think he has not joined his. So even his audio is not there, so I don't think he'll be able to hear us.
I'll call him and ask him to connect via audio.
He may need to unmute and then start.
So he'll connect.
I think we can begin, Mudita. We have almost 30 of us who are logged in here. So maybe a couple of more will log in. But rather than keeping everybody at hold, we can begin the proceedings.
Okay, sir. A very warm welcome to all the participants present here. We are overjoyed by your response for this conference and also for this pre-conclave workshop. I would like to welcome Dr. Amol Dongre sir, our resource person for today, Dr. Mahindale sir, Head of Department of Community Medicine, JNMC Savangi, and also our MMC observer for today. Also, Dr. Chetna ma'am, Professor, Department of Community Medicine, MJMS Sevagram, and all other delegates, teachers, and faculty members. I further request Dr. Chetna ma'am to kindly introduce Dr. Amol Dongre sir and welcome our MMC observer for today, Dr. Mahindale sir, for the conference.
Good morning. It is my proud privilege to introduce Dr. Ashok Mahadalissa. Sir is Professor and Head Department of Community Medicine at JNMC Savangi, Wardha. For Dr. Amol and myself, Mahindale sir has been an academic mentor since our MBBS days. We all have the highest respect and admiration for him. And today is sir's birthday and we wish him good health. Welcome, sir. Now I would like to introduce Dr. Amol Dongre. Dr. Amol has done his MD in Community Medicine from MJMS Sevagram, Masters in Population Sciences from IIPS Mumbai, and Masters in Health Profession Education from Keele University, UK. Currently, he is Honorary Director, Initiative for Empowerment of Health Profession Educators, Foundation for Diffusion of Innovation in Health, Vadodara, Gujarat. His areas of work are maternal and child health, community-based palliative care, medical education and research, and qualitative and mixed method research. He is recipient of FAMA Fellowship in the year 2008, WHO In-Country Fellowship in Community Mental Health from NIMHANS, Bangalore in 2011, and International Fellowship in Medical Education in 2015. He has conducted 19 national level workshops on qualitative and mixed methods since 2011. He is faculty at PSG FAMER Regional Center since 2011, Mahe FAMER since 2015, and FAMER Institute, Philadelphia for the year 2021. Welcome, Amol.
Thank you, madam. Thank you for kind introduction.
Abhishek, sir?
So shall I begin? Yes,
Yes, sir.
yeah.
I think we have a requirement that we'll need a photograph. So maybe request everybody to switch on their camera once, and we'll have a photograph, and then over to you, sir.
All right.
I'll request all participants as well to please switch on the camera for a moment.
Now that looks nice. So many people.
Yes.
Otherwise, we feel as if you're
We understand that it may be a bit inconvenient, but then because this all these CMEs, these workshops have also been given credit points by the Medical Council. So it's a mandatory requirement that for most of the time our cameras should be on. So if it's possible, keep the cameras on for as much time as possible. Ashwini Mandle sir is going to join.
He had joined, but I think he's left.
Yeah, he left to maybe he'll try and log in with the audio and video on.
Probably, yeah.
Yeah, so I think will this much be fine, Mudita, for your
Yeah,
documentation requirement?
Yes, so once
please take few screenshots and then we can begin.
So I think we are good to go. Once Mahindra joins in, maybe I'll take another picture.
Yeah, so
Otherwise,
I think
we are good to go.
we need not wait for him to join. I think
Okay.
we can begin, and he'll eventually
Yeah.
join. Should not be a problem. Sir, over to you, Amal sir.
Thank you, Abhishek. Thank you, Chetna, madam. And good morning to all of you. And first of all, I wish many happy returns of the day to Mahadalissa sir, my guide, and pray for his long and healthy and successful life. And I thank you all the organizers for inviting me to have a pre-conference on the topic of my interest, that is participatory and action research. Shall I start with my slides? I think you have given me permission to share my slide and start it. Okay, so here we go. Just give me a feedback. Are my slides clearly visible?
Yes, sir.
Is it okay?
Yes, sir.
Okay. So we are going to have a session on participatory rural appraisal and participatory action research. And let me give you an outline how we are going to have this session. The first is there are some assumptions when we are having this workshop, and assumptions about learning, how we are going to learn about participatory action research. So even though I have PowerPoint slide, I'm going to stimulate discussion among all of us, and we want to learn from you, and we want you to be vocal when we are having this workshop. So we want this workshop to be constructivist in nature, and we want a kind of social learning happening in virtual environment. And the only option that we have is chat box. And sometimes we may ask you to unmute and speak your point. So the assumptions about learning is of constructivism and social learning. So that means there are lots of interactions. PowerPoint slides are secondary. Interactions and questions are primary. So that's the assumption. So at any point of time when I'm speaking, if you have any question, you can raise your hand. And I think you know how to raise a hand. Perhaps there is an option here where you can raise a hand, and then Mudita will ask you to unmute and ask a question. So Mudita, will you please tell them how if they have any question to ask?
Sure, sir. Sure, sir. Dear participants, if you see your screen, there's a small smiley button there. At the bottommost part of your screen, you'll see a small smiley button there. If you click on that button, the first option that you'll get would be for raising a hand. Once you raise a hand, I'll be able to see you, and immediately I'll ask you, or maybe as per the convenience of our resource person, I'll ask you to unmute yourself and ask your doubt. I hope that's fine with everyone.
Right, perfect. Thank you, Mudita. The second thing, that if you are not comfortable raising hand, then we would encourage you to type your question in chat box, and Mudita will keep an eye on that question. And whenever there is any pause in the session, feel free, Mudita, to bring that question forward so that we can have a discussion on it.
Sure, sir.
So I request you to, thank you, Mudita. So I request you to keep your audios off so that no disturbance come. And then you can start your audios when you have questions between. Now, this is all about how this workshop is going to run. So we have one short film to see, and we have lots of discussion to do. And I hope we all have a stable internet connection when we go for it. And if it gets disconnected for some reason, just have a patience and things will be resumed shortly. Right. This workshop is going to, in this workshop, we are going to have a small discussion on definition of research, because it forms a component of the PAR, participatory action research. Then second, we are going to have some discussion on what is the purpose of research, who are the end users, are they defined, are we aware of those? And then finally, the challenges in utilization of study results. We do lots of studies, and every study starts with the line that there's a gap in the literature, and your study promises that you're going to bridge that gap in the literature. And by bridging that gap in the literature, what do we achieve? And we are going to have a small discussion on that also. The third thing that I'm going to touch about is philosophical assumptions in research, because once you're clear about philosophical assumptions, then you not only can plan a quantitative research in a better way, but you can plan any kind of research, such as qualitative and mixed methods, which are recent trends in the field of research, both in public health as well as in educational research. Then we're going to see a short film. Mudita is going to show us one film. And after we see that film, we are going to have a discussion on that film, right? And then we will have a discussion on what is PRA and what is PAR, right? And the definitions on it when we go for it, right? And then I will draw one small example on Elagiri School Health Project, and then some challenges in PAR, and then you will be allowed to ask questions. Now, after having this outline and making terms clear to you, I expect that you are active when the workshop is on. It should not happen that I'm speaking and you're listening. So in order to make that learning happen in a social way where we know each other, I would like to have a quick introduction of yours. And so you can start your video and just say that I'm Amol and I come from XYZ Institute and this is me, and that's it. So keep your introduction brief. So it will take little time, but I want all of you to know about each other. So we'll start with Mudita first. And then I will hand it over to Mudita to take everybody's name and invite them to introduce themselves. Right? Thank you.
Yes. Good morning, everyone. I'm Dr. Mudita Joshi. I'm a junior resident at MGMS Sevagram, Department of Community Medicine. I would now like to request Dr. Aishwarya Lakshmi NR to kindly turn on her video and please introduce herself to all of us. Dr. Aishwarya Lakshmi.
Good morning, everyone.
Good morning.
I'm Dr. Aishwarya Lakshmi. I'm from AIMS Nagpur, junior resident.
Okay, Aishwarya. So nice to meet you and welcome to this workshop.
Thank you. Thank you, sir.
I would like to request Dr. Anuj Mundra, sir, to introduce himself.
Good morning, everybody. I'm Dr. Anuj Mundra from the Department of Community Medicine, MGMS Sevagram, and I'm also a part of the organizing team here. So, thank you.
Thank you, Anuj. Nice to meet you.
So I would like to request Dr. Abhishek Raut, sir, to introduce himself.
Good morning, everyone. Myself Abhishek. I work as a professor at Department of Community Medicine, MGIMS Sevagram, and it's a humbling experience to learn from Amol sir. I mean, again, for us, Amol sir is equivalent with qualitative research. Yes.
No, we are going to learn from each other. That's the term I made it clear right at the beginning. Right. Okay. Thank you, Abhishek, for joining.
I would like to request Dr. Chetna Malay ma'am to kindly introduce herself.
I'm Dr. Chetna. I'm professor at MGMS Sevagram in the Department of Community Medicine.
Thank you, ma'am. I'd like to request Dr. Ashwini Kalantri, sir, to introduce himself.
I'm Ashwini. I work at the Department of Community Medicine at MGIMS Sevagram.
Thank you, sir. Dr. Birajda Shrikant Shivaji, could you please kindly introduce yourself to us? Dr. Birajda Shrikant Shivaji, could you please introduce yourself to us?
Yes, ma'am.
Yeah.
Hello.
Hello. Yeah, you're audible.
Hi, ma'am. Yes, ma'am. I'm Dr. Srikant Shivaji Birada, junior resident, Community Medicine Department, Rajiv Gandhi Medical College, Thane.
Thank you. Dr. Amogha Shri.
Good morning, everyone. Myself, Dr. Amogha. I'm working as a senior resident. I'm from Jesus Medical College, Mysore.
Thank you so much.
Hey.
Dr. Jitesh Kuvatada.
Good morning, everyone. Myself, Dr. Jitesh Kuvatada. I work as a senior consultant in Ministry of Health, Government of India. Thank you.
Thank you so much. Dr. J.V. Sivapriya. Dr. J.V. Sivapriya.
Are you able to hear me?
Yeah.
So, good morning, dear organizers, and good morning, Amol sir. This is my second time that I have been to Amol sir's workshop, and I'm really looking forward to learn more compared to the previous workshop from this workshop. Thank you.
I know. You have already gone through it anyway. We will ask you more questions then. Welcome.
Sure, sir.
Thank you, Dr. J.V. Sivapriya. Dr. Priyasha Panda, could you please introduce yourself to us? Dr. Priyasha Panda.
Good morning.
Maybe
sir.
they are.
Yeah. I am Dr. Priyasa Panda, working as second year junior resident at MKCG Medical College. Thank you.
Thank you.
Thank you. Welcome.
Dr. Tabassum Nawab.
to Dr. Amol sir and all the other organizers. Are you able to hear me?
Yeah.
Yes, we can hear you.
Yeah. So I'm working as assistant professor in Department of Community Medicine, Indian Medical College, Aligarh Muslim University, Aligarh, which is in UP, Uttar Pradesh. And I am also the medical officer health of Rural Health Training Center here. And I'm currently sitting here only and joining. So I hope to learn a lot because this is a topic which we only study theoretically in our curriculum, I think. And we need to delve deep into it. Thank you so much for organizing this workshop. Okay.
Thank you.
Welcome.
Thank you, sir.
Thank you, Dr. Tabassum. Dr. Yedhu S.
Hello. Good. Are you able to hear me? Hello.
Yes, we are able to hear you.
Very good morning, everyone. I am Dr. Yedhu from Department of Community Medicine at the AIIMS Nagpur. I'm junior resident here.
Yes. Right. Welcome.
Welcome. Dr. Anil Koparkar.
Good morning, everyone. I'm Dr. Anil Koparkar, working as associate with AIIMS Gorakhpur right now. I'm very happy to all my alumni, actually Amol sir and Abhishek sir. I'm alumni of MGIMS, so hope to learn a lot from you again, sir. Thank you.
Welcome.
Welcome, sir. Dr. Rachana Pavaskar.
Hello. Hello.
Yes, yes, you're audible.
Hello.
Yes, Dr. Rachana, you're audible.
Good morning, ma'am.
Good morning.
Good morning. Please carry on. Yeah. Okay, we'll go further.
Maybe, yeah. Dr. Satyanarayan.
Morning, everyone. Myself, Dr. K. Satyanarayan. I'm working as a professor in the Department of Medicine at Mamta Academy of Medical Science, Bachpalli, and we're affiliated to College University of Health Science. So I'm looking forward for a good learning experience.
Welcome, sir.
Moving on to Dr. Vinod Govindnikam. Could you please introduce yourself, sir? Dr. Vinod Govindnikam.
Okay,
All right, let's move further. Yeah. Dr. Gaurika Saxena. Dr. Gaurika Saxena, please introduce yourself to us. I think she left the meeting, so we'll go forth with Dr. Guru Vijay Kumar.
Good morning, everyone. I am Dr. Guru Vijay Kumar, junior resident in Siddhartha Medical College, Andhra Pradesh.
Welcome.
Welcome.
Thank you.
Dr. Jhansi, would you please like to introduce yourself?
I am Dr. Jhansi, working as assistant professor. Thank you.
All right. Thank you. Dr. Mohammad Maroof.
Hello.
Hello. Yes, you're audible.
I am Dr. Mohammad Maroof. I am working as assistant professor at Medical College.
Thank you. Thank you. Dr. Gaurika Saxena, would you like to please introduce yourself?
Hello, good morning everybody. I'm Dr. Gaurika Saxena. I'm an implantologist, currently pursuing my MPH from AIMS Rishikesh. I'm a junior resident.
All right. Thank you so much. Dr. Namrata Panigrahi.
Good morning, everyone. I'm myself Dr. Namrata Panigrai. I'm working as senior resident in SCB Medical College, Odisha.
Okay, welcome. Dr. Nellikal S. Dr. Nellikal S. Would you please introduce yourself? Yes, Dr. Nellikal.
Yes. Sorry. Good morning. My name is Dr. Shilpa Nellikal, and I'm a junior resident in Department of Community Medicine in GS College, Mumbai. And thank you.
Welcome. Dr. Prem.
Hi all, I'm Dr. Prem. I'm a junior resident from Jupma, Pondicherry.
Welcome, Dr. Prem. Dr. Nellikal, do you wish to say something?
No, I think she is clicking some buttons. She's exploring, and in that process, we are getting some raised hands and some request for annotation. So we'll give her a chance later.
Yeah, okay, sure, sir. Dr. Riva Basu.
Okay, sir, like I have been an ardent student of Amol sir for the last years, and it has really helped me a lot in doing quality research. I never miss a chance to interact with him because of the reason that he is more of an idol to me. His way of life, his philosophy, more than anything else. So thank you, sir.
We keep meeting and he keep listening to same lecture. Okay, welcome, Dr. Rivu Basu.
Okay, thank you, sir.
Okay. Dr. Rosna Mary, would you please introduce yourself?
Okay, she may be having some later. She will give her a chance later, right?
Yeah, sure, sir. Dr. Simi?
Good morning, all. I'm Dr. Simi, junior resident from Jipmer.
Welcome, Dr. Simi. I think I think everyone has introduced themselves. Is there anyone who's left out and has joined later on? You may raise your hand. So I don't see anyone who's left out. So maybe we can go forth, sir.
Right, good. So thank you for the introduction, and based from your introduction, I come to know that we come from very diverse settings in this country, and so that's really going to help us to have a discussion and raise questions and learn from each other through your experiences. So let's go further. Now, I have a first question for you. That is, I want you to think on the definition of research, and I want you to write down the definition of research as you understand in chat box. Write down that to me research is this, to me research is that. So whatever you feel that that's research, you write it down there, and then I will put my the definition which I got from one source. So start writing down in the chat box. So you know, I hope you know the chat box. Where is the chat box? There is a function called chat here. Just click on it and write. Start writing. Say that to me this is research. That's the definition of research. You don't need to be very scientific in defining it. You just say it in your own words. That's fine. So start writing.
Amol sir, are you able to view the answers in the chat box, or do you want me to?
I can
tell
see
them
that, right? I can see that. Yeah,
Okay,
thank you,
sir.
Nivita.
All right.
See that. So I see one response from Nellikal, Dr. Nellikal. She is saying that it's an exploration. Okay, anything else? Method to find out the truth. Okay, oh, the next definition is very big. Oh, it's too fast actually for me. Creation of knowledge and use of existing knowledge in new and creative ways so that we get the general concept, methodologies, and understanding. So looking for new knowledge, exploration. That's what we got. Okay, anything else? A process for translation of known knowledge into action. That's something different. That we are thinking about translation of knowledge into action, right? Exploring the reasons for any health status, assessing the magnitude of problem, and understanding and implementing the necessary action. Okay. Prove and disprove hypothesis. Okay, the process of finding answers to the question in a scientific manner with limited resources. Perfect. To accept or reject hypothesis. Okay. Then anything else? Please mute your microphones
Dr.
so that no
Barasta?
sound comes. Yeah, you can put that microphone off. Yeah. Now, okay, so I'm getting that we do it for exploration, we do it for knowledge, to test the hypothesis, to build understanding. Perfect. Any other thing that you want to say? Okay, now I agree to your part, the points that you have been mentioning here. And here is the definition. I am taking this definition from one book by John Creswell. Find out the truth in your universe and find out solution to the problem by Dr. Tabassum, right? I can see that. So here, this definition comes from one of the book on educational research, and I took it from that. But it says that it's the application of scientific and disciplined inquiry to study a problem and solve the problem. So what is solve the problem? I have kept in bracket. And most of you have mentioned that the knowledge generation is done for kind of taking an action. An action for what? On whom? And who will take that action? We'll see to that as we go further in this workshop. So I agree with your definition of research. And there are a variety of definitions of research. But for this workshop, we are going to focus on this definition which I'm putting forward. Now, the next question that comes up here in this definition, what is that thing if we do make this process scientific? You can write down in chat box. So, I mean, in order to say that your inquiry is scientific, what all you should have in it, then only you can call it that, okay, it's a scientific process. We say that, no, our research is a scientific inquiry that we have done in the field or in clinical setting. And our research is scientific. So what makes it scientific? What all you need to have in place or in your design to call it scientific? So start writing in chat box. Let me read it. Okay. No responses yet. Just think of it. What makes it scientific? Application of knowledge, technique, and methods. Okay. Use research method, systematic procedures and method, supported by facts and evidence. Okay. And correct methodology, control of various bias, probably a comparison group. Perfect. Okay. Okay, just think of it. And I agree to that. Let me give you a hint on it as we go further. And we say that we start research with a problem. We have to have a problem in hand. If you are doing MD thesis, we are supposed to state the problem. If you are doing PhD, you have to state the problem. You have to say, what is that problem which is actually stimulating you to go for that inquiry? So having a problem in hand is a perfect start for any research, let it be clinical, public health, or anything. So you have to have a problem in hand. Once you have a problem in hand, the next step that you have to think is solution to that problem. Now, once you say, I have a problem and I want to solve it, and you remember our definition say we have to solve this problem in a systematic and in scientific manner. So in order to solve this problem in a systematic and a scientific manner, you need three things in it, right? So can you guess those three things? Now write down your answer in the chat box. What are those three things which make that problem solving a systematic and scientific process? So objective material methods. Mudita, will you please read it for me because it disappears very fast.
Sure,
I
sir.
cannot read the small letters. Right. Thank you.
Dr. J.V. Sivapriya says it is objectives, materials and methods, and ethics.
Okay. Three things, she says.
Yes, sir.
Fine. Okay. Any other response?
Not yet, sir.
Okay. There are three things. Just think of it, those three things. And you all know that thing. And when I say those three things, you will say that we knew that thing. We know about it. Yes, one more response has come.
No, sir. Yeah, ask the right question first. Dr. Shiv Joshi says ask the right question first.
Yes, asking the right question is the toughest thing in research. Right? Okay. Any other? Right. So, okay, no question. But then I give you a hint now. I will tell you one, and rest of the two things you have to guess, right? Dr. Jitesh has written something. Design, yeah. So it disappears very fast. Can you read, Mudita?
So I'm yet to receive. I think Dr. Tapassum.
I think, yeah.
Yeah.
I think they are coming as a private message to me. Like, let me read it. I got it. Study population, study design, and sampling. And sampling. So I request all of you to, when you send a message on chat box, send it to everyone and not to send it as a private message so that everybody can read what you are saying. And then only the cross learning will take place, right? Okay, Dr. Muhammad is not able to send. Yeah, please.
So there are some people who are unable to send messages to everyone. For such participants, I would like to request you to kindly send them privately to me so that I can read it out to sir. Even that would do if you are unable to send it to everyone.
Right.
Thank you, sir.
Great. Thank you. Now just say that I'll give you one hint. You know that thing and you know it much better than you think. First, I will tell you that, okay, what is that thing which makes it systematic? I'm telling you that you require a data collection. Now just anticipate the next two steps after you do the data collection and write down your response in chat box. Because I'm going to raise a question on this as we go further in this workshop, right? So these things looks very simple, trivial. So Shiv has written, yes, we need to do data analysis.
So Dr. Ananki Monica also suggests that we need to do analysis of the data that we collect.
And then after data analysis is done, what next do we do? That's
Dr.
really difficult.
JV Sivapriya says that we need to focus on the results as well after the data analysis.
But focus on result means what? What do we do after the data analysis is done, when the tables are in our hand? Yes, Dr. Jansi has written some kind, Nellittal also has
It
written
is
same
analysis
thing.
and interpretation. Dr. Jhansi says
Yeah.
that analysis and interpretation is important.
Perfect. That makes it perfect scientific and systematic process. Now, next question I have. In research process, there are interaction between two things, researcher and researched. Researcher means the one who plans and execute, and researched means the study participant. In mainstream research that we do, who makes decision about problem, who makes decision about solution, who makes decision about systematic process such as data collection, analysis, and interpretation? You have two options, researcher or participant. Who make a decision on all this in our mainstream research? Write down in chat box. Researcher or participant? Yes. So many of you are writing as a researcher, make a decision, right? Right. So all of you agree for that, right? So that is called as research from ethic perspective. Research is done from researcher's point of view. Researcher will find out the problem. Researcher will do the review of literature, will refine the research question, will develop the search strategy based on that, get more articles, refine the question again, develop the objectives and all that things that we will see later. But it's the researcher is doing it, and that we call it as ethic perspective, means from researcher's point of view. Okay, so now we understood the definition of research, and we also understood that in mainstream research, researcher makes all the decision of this, and participants have no say in it. Participants' only job is to provide information what researcher is asking for them. I'm talking about mainstream quantitative research here. Now, here we go. Many of you are, some of you are faculties, some of you are senior resident, JRs. And you all know this research process. It goes this way. We have a research problem. We have to have a research problem in hand, right? And then we do review of literature. Based on that, we develop research question. If you are, most of you are from community medicine, so we are not used to use word called research question, but you may frame objectives, you may frame purpose statement, or you may frame research question. It depends on the research orientation that we have. So in public health research, we use objectives or purpose statement, or mainly the objectives. And in educational research, we use the term purpose statement and research question. Now, once you're clear about your research question, because you have to focus on your research question, you have to refine your research question. As Ashok was just mentioning, that you have to ask the right question. And you can ask the right question when you have two things in hand. One, you have an experience in that field, and second, you are aware of the literature in that field. So in that situation, you can ask good question. And that's why you need a guide sometimes to help you to refine your research question. Okay. Then once you're clear with your research question, you make a choice of quantitative methods, qualitative methods, or mixed method. If your research question, if you think that your research question can be best addressed by measuring the variables, go for quantitative methods. If you think that your research question can be addressed best by qualitative methods, by just exploring the people's opinion, perceptions, go for qualitative method. But if your research question demand for use of at least one quantitative and one qualitative, go for mixed method. Whatever you choose, you have to think of sample size sampling. You have to think of instrument development. You have to think of data collection. You have to think of interpretation. And then finally, you write a report with discussion, conclusion, strengths and limitation of your study. And what next, right? So this is how your research process goes on. I have a question here. Answer that question very carefully. Among all these things, which item do you think is the most difficult? So we can do a kind of a discussion on that. I'm going to ask you that. Write down in chat box which one is most difficult. First, is it a problem? Is it a review of literature? Is it a question? Is it a method? Or is it sample size sampling? Or questionnaire development, data analysis, interpretation, writing discussion? Out of that, which is the most difficult and crucial step in doing a meaningful research? Start writing in chat box.
So we have received one response which suggests Mohammed Maruf. He says it's a research question.
Okay.
Then we have other responses like research design selection, research design, best fitting our research question, methodology, review of literature, write questionnaire relevant to our topic, review of literature and
Okay.
methods.
Okay. Excellent. Any other response?
Dr.
Questionnaire
Namrata says it's, questionnaire designing.
Any other? Okay, excellent. And it depends on your experience of working in the field of research. So Dr. Sarah has written research design. Okay. So you mentioned, many of you have mentioned research question, design, material methods, review of literature, and questionnaire design. Nobody has written about analysis and interpretation. Okay. To me, I agree with your all responses, and each one of us have different types of difficulties when we do research. Based on my experience and my work, I find that it is the research problem that is the toughest thing. You may be knowing the issue, but then focusing on a problem. What problem do you study? So when somebody come to us with for the project development and they say, we have these objectives, we want to achieve these outcomes, but we say that, okay, then what's the problem on which you are focusing the study? So to have a good problem statement is the perfect start for carrying out any research. Now, in mainstream research, who decides the problem? Researcher or participant? When you plan your MD thesis or when you plan your project, who decides the problem? Researcher or researched? Write down in chat box.
So we have received 4 responses.
Right. So, perfect. So the problem statement is done by researcher. They do it. It's again from ethic perspective. So I emphasize that point once again here. And I also emphasize one thing, that as you become more and more senior in the field of research, you will experience one thing, that rest of the things are easy, but what is most difficult thing is having a good researchable problem in your hand. And then you ask a right question on it later. Rest of the things will flow with some experience, but this too requires theoretical sensitivity and experience to get a good problem in your hand, right? I'll come to that, and I will then give that example little later. When I did my MHP thesis, my study topic was on MD examination in community medicine. And so I had an objective that I want to know the expert's opinion on MD community medicine examination, the subject. And my thesis guide asked me first question, that's okay, we can study that topic, that's fine. What's the problem? What is the problem that you're going to solve by doing this kind of inquiry, by collecting this information? And who and how are you going to define that problem? That's important. So these things looks very trivial, but they are very important. And start thinking about problems whenever you are planning any kind of research. That's the message I gave you here. Okay, we go further. The next question I have, I'm creating a background for your PAR understanding, and slowly you're building on it, right? Now the next question I have for you people. Now this time I won't be asking you to write down in chat box, but I will ask you to do one thing. Take a plain paper if you have there with you, and I'm going to ask you first question. Give me one example from your setting, wherever you are working, where some study findings which happened in your department or in your setting were used for decision making and problem solving. Think of it. Don't think of next question. You just think of this. And if you want to share with us that, okay, we did this study, we got that finding, and we solved the problem using that finding, right? So just take a minute, because it will take time for you to recall. And the best time I can give you to recall is 15 seconds. So your time starts now. Start thinking and tell me one example where in your setting where the study was done and the findings were utilized for decision making or taking action. And raise your hand if you want to share your story with us. Yes, somebody wanted to say something, right? Please raise a hand, and then I'll invite you to unmute and say. Your 15 seconds over. Yes.
Ronanki Monica, Dr. Ronanki Monica, would you like to share your experience?
Yes, ma'am.
Yes,
Yes, ma'am.
please.
Sir, during the period of October to in between September, we did a study on proper uses of mask uses, sir, in normal people, in general population. So we have made a questionnaire and have interviewed them, all the patients who are admitted, and we asked them how they are using masks and how they are wearing masks, what they're doing, and how they're disposing that mask. And regarding that, in the questionnaire, we have asked everything. And in that, what we found that so many are using the mask not in a good, proper way. And some are using the mask for 1 week, for 15 days, the single masks without any washing or any proper precautionary measures. And we also asked regarding how what they are doing immediately after going home. So in that also we have seen that so many are missing some precautionary measures. So we have submitted the data to the district collector, and in a press meet he have mentioned all these problems, sir.
Okay, perfect. So congratulations to you and your team for carrying out
Thank you
this
so
work.
much, sir.
And you presented your findings to the end users of it. But
Yes, sir.
just think of it. We already your case fit into the second situation I'm putting up here. Is that you have an evidence that things work. We know that masks prevent the transmission, and people don't cooperate or accept on it. Your case fit into second one, right?
Yes, sir. Yes.
That you know the things work, but people don't cooperate on it, and then you study on it. So in that way. So thanks for sharing your story with us. Okay, we got
Thank you,
some
sir.
more.
Thanks.
Thank you very much.
Dr.
We got some more
Nalakal,
response.
yes, sir. Dr. Nalakal S would like to, I think, share her experience.
Sure.
I would request her to unmute herself and go to her.
Yes. So actually, sir, we had a study that was carried out by one of our faculty, and it was about PG teaching, experiences about PG teaching, and how it has impacted us, the students. And considering the lockdown situation, we were not able to have the sessions online. In the classroom. So a general feedback was taken on this, and with the collection of data, with all the answers, they came up with a better, a better way to carry out that PG teaching, and a more basically on everyone's consensus, and this was carried out, and I think that was more effective. Thank you.
Okay, so that's perfect. That's very exciting to hear that the feedbacks. But who obtained feedback from pages? I think faculties obtained feedback from pages, and then they modified the teaching learning. Is it so?
Yes, sir. So this sort of study was carried out by a faculty. She's an assistant professor, and she did this particular study.
Excellent. But then why do you say that it's effective? In what way it was effective?
Sir, it was, I think, firstly, when the questionnaire came to me, I was quite surprised. And I was like, yes, because it was something at the back of my mind that, I felt like maybe there could be better ways to carry out the PG teaching. And so I was, and that was thing. And I was able to share my opinion. And I also spoke to my friends, also my colleagues, and it seemed like everyone had the similar point of view. So yeah.
Okay, perfect. Now, let me ask you one more question here. How did you feel when you got that questionnaire and you were asked about, give a suggestion about PG teaching? What was your emotional reaction to those questions when you got that in your hand?
Sir, I felt very good actually. I felt this is so relevant.
Okay.
I think this is
okay. Right. So now that comes in here. So we got one example where use of masks, and second about taking feedback from the PGs and making modification in teaching learning program. Anything else that you did a research and that finding was used as a policy? These two examples are telling what you did in your tiny little world that you have around you. But can you give me an example where the study was done in a context and the evidence was used at national level or at the state level or regional level? The evidence was used at a very large scale. We're having thousands and thousands of research paper publishing, right? And in that, we are looking for the studies which actually brings about that change which we saw in the definition. And so even after thinking, we are struggling to get the right example of it. And if we think and if we stretch and if we look for literature, we will come to know that we always have a problem. We get the findings, we get the result, we get the interpretation, we get the recommendations, but we may have difficulty sometimes to see how we utilize those findings. Yes.
So Dr. Saira, I think she would like to put up her
Please.
example as well. So I request Dr. Saira Menas to go forth and share her experience.
Please, yes.
Yeah, can I talk now? Am I visible and audible?
Yes, yes.
You are visible and audible to us. I think her net is unstable. We'll just wait for a minute and then we go ahead, right?
Sure, sir.
Dr. Saira, your net seems unstable. Would you please write down your response in chat box and we'll pick it up? Okay. Now you're audible, it seems. Please go ahead, Dr. Saira.
Okay. Okay, so we did a study on migration. It was a 3-year-long study with ICMR. We did that on the migrant population, the newly migrated one. And along with their other socio-demographic problems, they actually, there are so many things that are there for this.
Okay, her net is
With was,
unstable.
yeah, they
Madam,
didn't know. Okay.
your net is unstable. Please keep your video off and keep your audio on. So that will help you to keep in connection with us, right? Thank
Can you
you.
hear me now?
We can hear
Yes.
you. Please go ahead.
Okay, I'll share at a later stage, so it's wasting your time.
No, not wasting time. Your experience is
Yeah,
valuable
it's
to
wasting
us.
your time, so let's leave it for now. We'll share later.
Okay, please write down in chat
Or
box.
I'll try joining with my laptop.
Yeah.
That's great. We'll wait. Once you join, let us know and
So
we'll
you can
invite
take up
you again.
others. Meanwhile.
Yeah. Any other response? Okay.
Yes, sir.
So, thank you. And so some researchers, they have observed one thing, that we have plenty of research happening. And in many of those cases, we do not know what to do with the results. And we have results. So we have plenty of accumulation of results, but we have very less takers of those results. And they have many issues such as they lack rigor, they lack statistical generalizability, analytic generalizability, or transferability to other contexts. And so many such issues are given, lots of limitations quoted for the methodologies used. So the end users remain poorly defined. And the second thing, that the rigor, the lack in rigor, raises questions on the evidence that we generate. So that's a major issue that we have in mainstream quantitative research. Now, what I'm going to put forward here are some philosophical assumptions about research. So you may find this little heavy, but let me put it this way. There are 4 major philosophical assumptions for carrying out research. Once you have a problem in hand, I told you that you need a problem in hand, then you have to think about which philosophical assumptions will be better to help me to develop research project based on that. So in Asian region, and I would specifically say in Indian region, we give very less emphasis on philosophical assumptions when we plan our research. We write objectives, we write material methods, data analysis and interpretation. And there is no paragraph on philosophical assumption. And when I was doing my MHP thesis, my guide asked me, what's the problem? And was a philosophical assumption. I just wrote 2 lines on philosophical assumption, and he said, no, write a full paragraph on it. What are your philosophical assumptions? So what are these philosophical assumption means? These are paradigms. Philosophical assumptions are set of belief about the nature of truth and reality that you are going to measure. In quantitative research, we will see in this diagram, researchers believe that there is only one single truth in the universe, and that is measurable, verifiable by others. And we call those researchers as positivist researcher and post-positivist researcher. So your entire epidemiology comes under post-positivist research, where you believe in single truth and where you collect data using measurable variables. In that case, we say you are post-positivist researcher. And they believe there is only one single truth. Okay, then another situation, you have some researchers, they don't believe in single truth. And they say that, no, there can't be one reality. There are multiple ways of looking at same thing. For example, why people don't use masks. There is no single reason for it, but there are multiple reasons for it. Why students don't study throughout the year? There's just not one reason for it. There are multiple reasons for it. And we say that the reality has multiple dimensions. It's multifaceted. And so they don't believe in single truth. They believe in multiple reality. They don't believe in objectivity, but they believe in subjectivity. And those researchers, we call it as constructivist researcher. This paradigm became dominant after World War II and somehow in Indian subcontinent and in Asian region. Our universities did not incorporate much discussion on this paradigm. And because of that, we don't use them often. And so most of the qualitative researcher will fall into constructivist paradigm because they believe in multiple reality and subjective nature of truth. Now, there is a third methodological movement going on in current time. Everybody is doing mixed method research. The dichotomy between post-positivism and constructivism is over. And after 1990s, we started living in third methodological movement called pragmatism, where researchers use at least one quantitative and one qualitative in one single design and answer the research question using that. This is called as pragmatism. So most of the mixed method researchers are called as pragmatist researchers. So I told you three of them, and today's workshop we have nothing to do with any of these, but we are going to say something about fourth paradigm, and that's philosophical assumption. Can anybody guess what is that fourth paradigm? If you know, write down in chat box. There is a fourth paradigm also in research. And today's workshop revolves around that fourth paradigm. So those who have listened to me before can very well identify that and it's a test for them. Write down in chat box. And I give you a hint. It's very much related to, okay, Dr. Shivapriya has written advocacy, but you missed one word before that, Dr. Shivapriya. Yes, now she wrote that it is participatory, yes, participatory action research. Perfect, I'm happy. It is called as advocacy and participatory paradigm. And the purist researcher, even call it as critical theory, where researcher is supposed to consider cultural, social, economic, and political factors when they plan the research project. So this is the fourth paradigm. It sees research as a social action, not just action, not just change, but it's a social change. So it means this is going to revolve more around social issues. Second point, we have to remember it's more of empowerment oriented. Can anybody tell me what empowerment means? What's the definition of empowerment? Write down in chat box. To me, empowerment means this thing. We use this word very often. Empowerment. So what does empowerment mean? So write down in chat box. Ability to take decisions regarding own self, Dr. Tabassum. Perfect.
Dr. Ashok,
Empowerment. Yes.
so she has sent me a private message saying that according to her, empowerment is upliftment.
Okay, upliftment to facilitate self-confidence. Okay, I'm reading these responses. Any other?
Building
Yeah.
self-confidence to carry out things independently, authority given to the people itself, allowing a person to achieve full capability.
True. Yeah. So it's more of helping people to make them capable so that they take right decision for themselves. And that helps us to make that social change possible. And it looks exciting that can we do that kind of research where we carry out all those scientific activities to bring about social change. And we'll add some more elements to it as we go further, but can we use that? And that's exciting. So it's more of collaborative in nature. It's more social change oriented. And your participatory action research comes under this philosophy. And another thing I say that it talks about, it's a kind of leadership and management. So some people say that I'm a PAR practitioner, I'm a participatory action research practitioner. So that means they bring about this, they don't use this just as a philosophical assumption or as a methodological approach to solve the problem, but they use this as their kind of a lifestyle or leadership style to mentor their project staff on that. Okay, so now it's a time for us to see a film, but before we see a film, I would say that it is 11:80. So shall we give a 5 minutes break here, Madita, and then we'll start with the film, or shall we show the film first and then go for the, because they have asked a lot of questions, and after they see the film, I have a lot of questions for them. So let's give them a kind of a it's 11. 3 minutes break is enough. 3 to 4 minutes break. Right.
As per your
So
convenience.
we give them 3 minutes break. Have your water, tea, coffee, whatever you want to have. And then we'll see a movie. And then we'll have a discussion. And then we'll have some more slides on it.
So I'll transfer the presentation rights to myself so that I'll be able to present the video. I hope that's all right.
Yeah, let me stop sharing, and then we will start video after 3 to 4 minutes.
Sure, sir.
And then we'll have a discussion on that later, right?
All right, sir.
Yeah, I'll just get a cup of tea for me.
Sure.
So are you all back? Shall we start?
So shall I start sharing my screen?
Yeah, but let's take from others. Can you give us a thumbs up sign if you're back? You can give a thumbs up by using that something. What is that called?
Yeah. Yes, sir. So we are getting a few responses. 6, 7. So around 10 people have responded with a thumbs up.
Okay. So let us start then.
Okay, sir.
So you have to start the video. I will keep myself mute and
Okay, sir.
They will see the video. Now, let me give you a caution on this. This video is in Hindi language. You will get English subtitles. And even if you don't get that, don't worry. By just looking at the animation, you will get what it is about. Okay, so enjoy this animation here. And we'll have a discussion on that. So over to you, Mudit.
Thank you, sir. So is the video visible?
Yes, it's visible. You start it. Yeah. The audio will come later.
So the audio, you were able to hear the audio, right?
Yes, you carry on.
Okay, sir. All right. Thank you, sir.
I think it's lagging behind.
Okay,
Nidita,
sir.
it's going
Yes, sir.
slow, but can others see that? I'm not sure about that, but I'm saying it's lagging a little bit. Can anybody give us a feedback on if it is clear to you? Yeah, okay, it's
we are
lagging.
receiving.
Okay.
Shall I
Okay.
read?
So shall I try from my side sharing it?
Let's search. So if that's convenient to you, I think that would be better. I'll stop my
I'll
screen
try.
sharing. Yes, sir.
Yeah,
So
I'll
just give me a
try.
minute, please. All right, sir. So I've made you the
Yeah.
presenter. You'll be able to present. Yes, sir.
Okay, okay. I opened it, but wait a minute. Just give me a feedback on that. If it is clearly visible, I'm running, okay? Is it going well?
So we can see the video, but not the audio.
Or no audio is coming?
No, sir.
Okay, then I say that you try from your end, and
Okay,
that
sir, I'll
was
do that.
better than mine, right?
Okay, sir. All right, sir. I'll do that.
And let them try on it as they can see, or you have this video available on YouTube. If you click on whose reality count, you get a link on it. So I request Shiv to get a link and post it in the chat box. Those who miss it can see the link on their system. Carry on. No audio is coming, but anyway, we can see it without audio, no problem. Carry on.
So I'll try sharing that again. Give me a minute, please.
Yeah.
So is the audio there now?
No, video is coming. We don't have
Not
audio.
the audio?
Ah, it's coming now.
Okay.
Carry on.
Okay.
It will lag, but it's okay. We'll go ahead with that.
Okay, sir.
Pause the video here. Okay, so please read the message. What's there?
So shall I read it aloud?
No need. I think they can read it themselves. Okay. And then we'll stop at that. We can stop sharing video now.
Okay, sir.
Let's hope that some of them could see it, even though it was lagging. I hope you could get something out of it. I request any one of you to be a volunteer to explain what happened in the story. Anybody want to raise hand and explain what happened? So Mudita, what did you see in the video?
So Dr. Tabassum Nawab has raised her hand. I would like to request her to go forth, mute her mic and share her screen.
Yes.
Okay, that was a very nice video, sir. And the last message is also printed in our center. So what I saw in the video is that although the people who are deciding the outcome or the look or the fate of the village are trying to do good for them, but they are sitting at top. That is, they have a barrier with the people. There is a lack of connect between the people and the authority when they are not on the same level. So the villagers, what they are thinking, what they are wanting, they are expressing, but it is not getting to the higher authority. What we call decentralized approach, which is now practiced or being tried to practice. So when they remove that barrier, when they all came to that same level, and then the message was clear to them what the people want, and so they worked together. Then again, they worked together because the people themselves went and chose what the plant they want to plant, and then they participated. There was community participation, that one was watering, the other was watering the other day. They were preventing animals from eating the plant, and this shows that there was community participation, there was intersectoral coordination also. So what we call that thing, so it had everything in that: the participation of the people, the willingness of the higher authority or the political willingness, which we call, and lack of prevention of the lack of communication, which is the most important thing. So as you are calling that, go and live with the people, then you will understand what is the problem and how we ought to solve it, and involve the people in solving it so as to get the best results, and then everyone will be happy. There is a line which says, the boss had never seen, I had never seen the boss very happy when they were showing pool dikh rahe hain sab kuch. And then later in the video, it seems the bot had never seen the villagers so happy. So this is the change which is very remarkable. So this is what my interpretation is. Thank you so much.
Thank you, Dr. Tabassum. You did it very good. You expressed it in a very nice way. Thank you for your feedback on that. Right? Thank you, madam. So what Dr. Tabassum was covering was decentralized approach, some kind of non-hierarchical approach, a kind of community participation, and she also see intersectoral coordination here, and a kind of political will. Anybody else want to say something on that? You're most welcome. Please raise a hand, and then Mudita will invite you to unmute and express yourself. Yes. Somebody has raised a hand, it seems. Dr. Mudita? Nobody raised a hand. Okay.
No, sir.
Okay. So,
Dr. Ronanki Monica has raised her hand. Would like to request her to unmute herself and go forth with the explanation.
Sir, what I have felt was that from previously there was a top to bottom approach. Now there is a paradigm shift to bottom to top approach. So what I have found that this bottom to top approach, how that is very much successful. So from bottom to top approach, in that we can know the felt needs of the community and felt needs of the people. So what they really want. So that's what I found there. So it is a best representation of from top to bottom to top approach.
Right.
Yes.
Excellent.
Thank you, sir.
Very good. Thank you.
Thank you, sir.
Okay. Thank you, madam. Thank you. Any other response? Okay. One more response I would like to get before I show my points on it, because you match with me on many things and with the literature which I'm referring to. I have this workshop. So anybody else? Yes, Madita.
Thank you, sir. So my understanding from the video was that the beneficiaries, we need to communicate with the beneficiaries and we need to understand what their needs are. Instead of what we see as a problem, we need to identify the problem from their perspective. From that is when we can benefit them a little more. This is one point that I would like to add, other than all those that have already been discussed, sir. Thank you, sir.
Perfect. Thank you, Dr. Madita. And I was about to say the same thing here. Whenever we identify a problem for any social change, I'm using words very carefully here. So whenever we identify any problem for social change, then how do we identify that problem? Do we identify that problem just based on our experience? Or do we identify that problem by reviewing the literature? Or do we identify that problem by interaction with the local community or the target audience or the patient group on whom you want to implement your project? So the Creswell's book says that there are three major ways of identifying the problem. One, what your experience is, what your peers say in that field, and what literature says in that field. So that is for conventional research. There are three ways to get the problem. But I'm adding fourth way to it. I don't say but I would say the PRA practitioners add fourth dimension to problem identification. That you get problem from your experience. You speak to your peers. You do the review of literature, but also do not forget to talk to people or your patient group or your target audience for whom you are designing the project. The reason being, by doing so, you can contextualize that project. And without considering the context, the interventions are not successful. So that's why you see many a times that we tell them something to do, but they don't do that thing because we don't take into consideration the context. And that's the major argument that we have every time when we plan research, let it be quantitative, qualitative, or mixed method. So the recent focus in research is coming that are we doing context-specific research? And are those findings acceptable to those people? Right? Did you see one issue of acceptability? The boss was a nice person. He had a good intention of giving benefit to the people. So he was supplying them flowers. He thought that people will cultivate flowers and they will get good fragrance out of it. His intention was good. But when he actually went to field, he found that his ethic perspective of supplying flowers is not acceptable to the people, but their emic perspective was demanding for mangoes, and they told the reasons why they want to have a mango tree there. And this type of situations do occur in most of the social change process, that we supply them something and they ask for something else. And this negotiation between researcher and researched to have an agreement on the problem is a perfect start. Did you also see in this film, see this film very carefully, did you see in this film that the boss identified the problem with the villagers? He got his understanding validated from them. And later on, they do the planning and implementation together. The planning and implementation was done together. And the problem identification was also done together. He goes and he talks to them. And their interaction between the two co-construct the problem. And then they define it. Okay, this is what we want to do. And this is one reason to make the problem more context specific and more acceptable solutions come out for it, for that problem, right? And you can use some systematic process in between. We are not going to make this process that we go, we talk, and we just implement on what they say. But we have to use some systematic processes in between, and that we will be seeing shortly. But before that, we have to understand the problem development procedure for that. Most of the policy decisions that we do in the type of governance that we have, they are mainly expert driven. They make decisions, they think about what is right for the people. And I don't say that they are wrong always. They may be right because they have data evidence, but do we also speak to people in some way? Most is expert driven. And then second thing, you will be surprised with one thing. I asked you this question on second or third slide. How do we take decisions? So most of the decisions are taken on perspectives, and I would say in education sector, most of the decisions are taken on perspectives, and there are no evidence for many of the things that we do. Just you are powerful. You make decisions. And that increases the gap between researcher and researched. And that increases the disparity. Rich become more rich and poor becomes more poor. So who hold the stick matters a lot. So that's the argument PRA practitioners put. And they say that expert-driven culture. So when this workshop started, you introduced me and I reflect on that introduction and my own identity. And I come to know that, oh yes, I'm also a part of that expert-driven culture. I put up a lot of designations, tags to my name. And so that all holds the ego. And when you go to people, this ego acts as a big barrier in your learning process. So what do I need to do to leave that ego side and leave my designations, powers at one side and be more approachable to people? Not approachable in terms of physical access, but in terms of psychological access. Do they feel comfortable talking to me on their health issues? Right? And that makes a big difference, right? And so that's the thing that we have to remember, that decisions are mainly based on perspective. This creates a very solid rationale for carrying out qualitative research, because decisions are based on perspectives most of the time, though even though evidence plays a role in many scientific matters, but I'm talking about behaviors and social science related issues. Then comes the ethic-emic distinctions. We have to be consciously aware of it when we are planning research. And rest of the point, you all have summarized it very nicely, and I thank you very much for sharing your experiences with us. All the points that you made are valid and acceptable. Now, let's go further and little deep of it. Because Dr. Tabassum used the word community participation. So now we need to think about it in more detail. And she also used the word intersectoral coordination, non-hierarchical, decentralized approach. And Mudita also mentioned about problem identification to be done together. And I think Dr. Shiva Priya also mentioned one point, but I forgot. But I think she also mentioned on the similar lines. Now we have to think of the term community. What is community? How do we define the term community? Have we ever asked this question to ourselves? What's the definition of the community? What does it mean? So can you write down in chat box, what is community? Write down in chat box. We say, no, we are community medicine postgraduate. We are community medicine specialist. So what's the definition of community then? So write down in chat box. Social group by geographical boundaries. Okay. I will ask Mudita to read it. Wait a minute. I think she's busy with something else. I just read it here. Group of people living together, sharing common characteristics. Okay.
So, Dr. Yedhu S. has also suggested the very same group of people with similar characteristics. Dr. Ashwarya Lakshmi says that it is a group of people having similar socio-demographic characteristics and having common problems. Dr. Rananki has said that a social group by geographical boundaries with common interests and values.
Yeah, so they are a group of people hold together with some geographical boundaries, with some way of living. Anything else apart from that? Okay.
Dr. Tabassum has replied, a group of people with similar cultural characteristics living in a geographical area, people who are end users of any service, who are having a problem.
Now, do we always define community with reference to geographical boundaries, for example, villages in one PHC or number of wards in particular slum. So this is one way of defining community with terms of geographical boundaries. But is there any example of community without geographical boundaries? Can you think of those? They don't have geographical boundaries, but they are community. And that is what we call, that word nowadays is community of practitioners.
Dr. Tabassum has replied saying
Yeah.
doctors. Dr. Priyasha Panda says it's slums. Dr. Revu Basu says social media community. Dr. Sivapriya says professionals. Dr. Namrata says work community.
So, can you think of community where people from different professions come together and work together? Any setting, can you tell me? Where people from different professions come together for common goal?
Dr. Tabassum says public health professionals.
But they are different professions come together.
Dr. Satyanarayan says it's NGOs. Dr. Sivapriya says it's conferences.
Just think of hospitals, clinicians, public health, nurses, social workers. They come together. So that's a hospital community, village community, urban slum community, school community, the community of professionals such as nurses, doctors, and the new term that we use, community of practitioners, and all that things. So whenever you are thinking of a problem for research question, think of community, and that community can be used in participatory action research. So be clear on the PAR, the community in your PAR. Okay. Now the second question that comes, and I think you all are very familiar with it, what is community participation? And I won't be taking time on that, but it says about you need to involve them in some way or the other in whatever you are doing. That is what we call it as community of practitioner, community participation. And this community, just remember, can be defined in a variety of ways, fluid boundaries to it. So whenever you are talking about community practitioner, community, define the term community in whatever project or research you are doing. Have you ever tried involving community in whatever you do so? Can one or two people volunteer and tell their experience? That we did a project and in that we tried to involve people in this way. Give us one or two examples. Please share with us, and we want to learn from your experience. Do not shy, do not hesitate. Raise your hand and share your experience. Yes. Yes, please go ahead.
So Dr. Revu Basu would like to say and share his experience. I'd like to request him to unmute his mic.
Okay, sir. So I want to share like one of the pure qualitative research projects which we did in our college with the help of a tuberculosis operations research funding. So we found that the psychological profiles of the MDR TB patients are not much discussed about. Okay, and there are not much support system for them too. So and it is extremely necessary for the drug reactions and also for the like poor outcome of the disease. Okay, so we decided to do a project, and here we involved psychiatrists, psychologists, one sociologist, public health professionals, and chest medicine physicians together for the project. And actually, we all learned from each other, and we all benefited from each other. We had a common interest, and then we disbanded. But still, the friendship is there anyway. So I think this is an example of a community for a project of varied professionals coming together for a common interest.
Thank you, Dr. Revu. Excellent work. Brilliant work. I'll give you one new name to it. Right. Thank you, Doctor. Yeah.
So Dr. Sivapriya would like to share her experience. I'd like to request her to unmute herself and go ahead and share her experience.
Yes,
Sir,
carry on.
this is one of the study which we have done in our rural field practice area, sir, wherein we want to find out the challenges faced by A&M community for provision of immunization services during the period of COVID. So wherein I asked them to list out the challenges that they have faced and discuss among themselves and plot it in the form of a chart. So among them, the biggest challenge that they found was finding a transport for reaching various fixed sessions for provision of immunization services. So we have given the same input to our medical officer, and we are about to share the paper to our DM and HO in coming futures.
Okay, but then how did you ensure their participation in problem solving? So you got the needs from them, right? What they look for. But do you have an example where they were actually active with you in solving the problem?
Yes, sir. Simultaneously with the challenges, we have asked them what are the solutions that you are planning to give for a particular problem. So we got one, I would like to share one solution, sir, that is provision of mobile vans for provision of services during the periods of, during these special situations.
Supplying them the vehicle, that was their demand, right?
Yes, sir.
Thank you, Dr. Shivapriya. Thank you. Yes, any more experience?
Yes, sir. So Dr. Jitesh Kuvatada would like to share his experience. I request him to unmute himself.
Yes, sir. During our post-graduation, we were posted at one ashram where there are ITI students studying in that ashram. And during that period, we have to get the teaching of the public health topics to them as an additional work. So during one of the lectures of reproductive health on adolescents, I found that there are some gender-related issues or gender inequality like conceptions in their mind during the discussion. I found that later I designed a questionnaire over gender inequality aspects and everything, and we had some intervention questionnaire completion. And later I used that theater of oppressed techniques to have a conducting workshop when the all participated to it's one of the other scenario where there is a depiction of the gender inequality in the community in day-to-day practices, like whenever there is a bus going on and some lady is standing with the pregnant child in her hand, what will be the solution offered to that lady, something. So in during that process, they understood that what the questions were asked in the pre-test were related to all these situations happening in day-to-day life. And later in the post-test, we found that there is a change in their behavior, thinking process, and the knowledge regarding all these aspects. So that was the participatory thing.
All right. So thank you, Dr. Jitesh. I really like this, like the idea of using theater of oppressed to address the gender issues. That's really fascinating. And Dr. Ripu Basu said that how he brought different professions together to solve the common, to meet the common health goal for tuberculosis patient. And that is what we call it as nowadays interprofessional practice, IPP. And Dr. Shivapriya mentioned about how she took a lead on understanding the problems of A&M community who are providing services in field setting during COVID pandemic. So wonderful experiences. Anybody else? That's the last experience you will take, and then I'll share my experiences. Your experiences are really exciting. Interprofessional practice and using theater of oppressed for involving people and different professions together. Anything else? Anybody want to say something? I know you all are very experienced people, and you people are simply shying out from telling your wonderful stories to us. So don't keep it to yourself. Share it with us. We want to learn from you. Okay, anyone?
I don't see any more hand raises or
Okay.
anything in the chat box, I think. Yeah.
Fine. So we go further.
Yes.
Excellent. Brilliant. And I think that because of, since we are not able to see each other, you are feeling a little discouraged to tell your wonderful stories, but I hope you all have something or the other to tell us. And let's go further. I tell you one small observation, and then I will take you to the study. For those people who are from central India, perhaps they know this story, but for those who are from south or extreme north or east, may not know about it. But there's a small village, a town called Anandwan, Chandrapur district of East Maharashtra, where there was a person, he was a farmer, and one day while he was coming back from his farm, he was coming back home, he saw one leprosy patient by roadside, and then he brought that patient home and offered, he and his wife nursed him, offered him some puffed rice to eat. And then it became a habit of that couple to bring their this kinds of leprosy patient. And in those days, leprosy was not treatable, curable, and there was a lot of stigma associated with it. So he and his wife, and later on his son became doctor, and they are running wonderful project activities. So what they did, they brought those leprosy patients, they empowered them. You remember this definition that you have mentioned, that helping people to take their own decisions and live their life in a dignified way, in a respectful way. So he somehow involved them in doing agriculture, doing some suits, cloth weaving, and he helped them to generate their own income and live their life with dignity. He involved them in their self-care in this way, and he did their empowerment. And I would say that he did this work without any philosophical assumption or something. But when I see his work, I try to fit it in this way, and I interpret it in that way. So his work has been appreciated. And I see his work indirectly a kind of a social change that he was trying to do with the people's involvement and helping them to live their life in a respectful and in a dignified way. Now, this is a story about, I was telling you about Central India. So since you people have shared your stories with me, so I'm sharing one story here again. So there are two participants from Pondicherry, and I'm sure they will quickly identify. This is a wrong beach in Pondicherry. So one fine morning, we have been here to organize one program. And what was that program? I'll tell you later. In 2009, I went to Pondicherry, and I thought that because in Sevagram, I was part of a kind of project where participatory action philosophy was used. And I thought it is used only in rural area. And I thought this is practiced only in a handful of places. But as I traveled in this country, I came to know that people have used this philosophy in a different way. And I was lucky. I was invited to evaluate one project called community managed palliative care. And that was a surprising moment for me because, you know, involvement, forming women's self-help group, forming men's self-help group, forming adolescent groups, they are all community participation strategies I had learned about. But I never learned or heard about forming self-help group of old people. And that was a shocking for me. And I went to attend one such meeting I forgot the name, but I think it's near Madurai. And so in one of the village, I went to see with Rajeshwar sir. He's one of the well-known PRA practitioner. And so I accompanied him, and I just did the observation that how they formed self-help groups of old people. They formed a federation called Elders for Elderly. Old people will take care of old people. And that was something very exciting. And I came to know that, okay, PRA, participatory action research, is just not for maternal and child health, but they can be used for any of the problems that you have around, and even for geriatric problems. And that was a learning point for me. And I very closely observed their project activities. What do they do? And we could evaluate that project. And that was the aha moment in my life when we published a paper stating on it that community managed palliative care programs work. And we had a question on it before, whether it works or not, because there was not solid evidence for that kind of approaches. But when I saw that project closely, I found it works. It has a lot of components which really works well. And we could witness one walk, and we have seen enthusiastic participation by people in walk against elder abuse on the rock beach of Pondicherry, one of the biggest gathering of old people had ever seen. And one lady, she was 99-year-old, also participated in that. So people take part into it when they get convinced about your intentions, and when they feel confident that you are doing right for them and you are facilitating them on the right track. Okay, so we have seen that, and let's now go into little bit detail of community participation. We know that in your part textbook, if you read, I think all of you read part textbook, but if you read it carefully, Dr. Park has written involvement of community in planning, implementation, monitoring, and evaluation is important. Dr. Park has written a long time back in his book under the title called Held by the People, right? And we'll have questions on it later as we go further. Now, if we see the further, in that book, the same book that we read, in that it's written that village health guide, Anganwadi workers, ASHA, the variety of volunteers, the panchayat leaders, community-based organizations, they are all kind of community participation. So these are the kind of strategies that you have. Now, in that book, on page number 10, the 2019 edition says, medicine is a politics on large scale. So in a way, it's a hint for us that it's a kind of, you need to have a kind of participation, participatory advocacy. And when you involve people in doing something, it involves lots of politics, because human beings are highly political animals, and they don't do anything unless they are convinced that there is something for them in it. None of us will participate in anything unless we know what is in it for us. And that is what it's called as medicine in politics on large scale. Now, if you see this, another definition given in 1941 says, health is the responsibility of community. Now, this idea is there since long. So in this workshop, what we are discussing is not anything recent, but it's quite old. But what is recent is to think in terms of research for problem solving. Perhaps that perspective is new. So physician alone cannot fight the disease. Health ought to be the responsibility of people themselves. So community participation is emphasized again. Now, Dr. Ribu Basu told us an example that how he involved different professions. And he developed a kind of a support system for tuberculosis patients so that they made the desired outcome. And he also mentioned a very nice line that in this, we were learning from each other. We were getting merged like this as a team. And all that comes under called as deprofessionalization, demedicalization. And more recently, we use the term interprofessional practice and interprofessional education. When we work in hospital, we talk about, whenever we talk about participatory action research, it is not about going to villages and doing something for them. We can start practicing PAR right in the hospital. How? In hospital, doctors, nurses, social workers, they work together. But how often do we consider their opinion in decision making? Very rarely, right? And that is what that focus is coming, that interprofessional practice, that whenever you make any decisions in the hospital, bring doctors, nurses, and social workers together, you have a decision on it. Well, I'm not an IPP practitioner, but one of our senior colleague, Professor John Gilbert in Canada, he's a big advocate of IPP and IPE education, and he makes a very nice line. that you teach doctors in medical college, nurses in nursing college, social workers in social college, and one day you bring them together and ask them to work together. And they are not likely to work together because they are taught separately. So he advocates that there should be some classes where doctors, nurses, and social workers sit together. And so the recent trend in conferences is that there should not be a conference only for doctors, nurses, and social workers, but there should be a conference for health professionals. So all of them come together, dissolve those boundaries of professions, and come together. And so the participation theme is not only in rural area, it's not only in slums, but it's also coming and required in our hospital setting as well, now and in our work settings as well. Most of the projects program use community participation as one of the strategies whenever they plan any intervention, particularly in community-based projects. So remember, one of the principles of primary healthcare is involvement of community. We know that. Why do we need community participation, and what's the challenge for it? Can you write down the response to the first question in chat box? Why do we need community participation? Why we should do all these things? What will happen if we do that? We know the answer for it. I'm just checking whether you are with me on that point or not when we are discussing. So start writing in chat box. Any response?
So Dr. Mohammed Maruf says it's acceptability.
Okay,
We need it
perfect.
for acceptability. Dr. Jhansi says that we need it for sustainability.
Perfect. Yeah. And third thing I would add is empowerment, because whenever we, the point has been mentioned by Dr. Gauri Saxena, that empowerment. Yeah. And when we involve some people in doing something, there's an exchange of knowledge between researcher and researched. And that exchange of knowledge causes empowerment. But what's the challenge? We'll come to that challenge later. So I'll leave it for some time. So what we need it for community diagnosis, we need it for empowerment, and as you have rightly mentioned, we need it for acceptability of it as well. And it's important even when, can you please read what Dr. Gauri Saxena wrote? I missed it.
Yes, sir. Dr. Gaurika Saxena says community engagement is important, even critical to community well-being.
True.
And Dr. Ronanki Monica says it is required to increase awareness of local needs and increase people's role in decision making.
Perfect. Thank you. So we saw the different ways going about it, and there is no one single best way to go about it. You have to take into consideration the context in which you are running the project, what is feasibility, and the resources are available for you. So something which works in Sevagram and in Pondicherry may not work elsewhere. So you have to take into consideration the context when you are planning any intervention through PAR. Now we come to the point that we were thinking, now it creates a good background for us, that participatory rural appraisal was the first idea that came forward. And in that, it was mentioned, Robert Chambers is one of the authority in that field, and he says, participatory rural appraisal, PRA, is a family of approaches and methods which enable rural people, I'm just keeping rural in the bracket here, people to share, enhance, and analyze their knowledge of life and condition to plan and act. I mean, when I started working on it, I could understand that they can analyze their knowledge, but how they can plan and act on it. Is it possible that rural people can analyze their situation, act on it? They're not educated people. Will they be able to do so? Now, that's a question. But the PRA practitioners give a confidence that no, people have a capacity and they can analyze that situation. And that's really a thing that you all can test in your life, whether that really works or not. So just don't believe in my experiences, have your own experiences to check whether that works or not in your context. But I'm going to put it in a little biased way, stating it works for me, it worked for me, but there are some challenges to keep in mind when you see to it. Now, I recommend all of you to buy this book by Paulo Ferrari, which was published in 1968, Pedagogy of the Oppressed. It's a wonderful book which influenced many people. And this book gave birth to that fourth paradigm in research, participatory and advocacy. And he was the first one to bring it very strongly that the weak people should be empowered, oppressed should be strengthened. And that's really a very inspiring book. When you start reading it, this book, every line is so powerful that when you read a paragraph that you come to know, you learned a lot by his thoughts. Now here comes a question for you. Now we all are convinced with this thing, what is problem, how we should involve community in identifying that problem, what makes that process scientific, what you should do for that. And we defined the term community. We learned about community participation, the different strategies for it, and we are convinced that we need to think about it. Wherever you think it works, you go for it. And we also learned that community participation is not for rural, not for urban slums, but you can think of the work settings wherever you are working. Next question I have is how to involve people in needs assessment, how to involve them in planning, right? We think that the planning is job to be done by educated people. Monitoring is another difficult task. How can they monitor it? Will that really work? Because monitoring requires a very sophisticated systems in place to make sure that the things run. And finally, the evaluation, which is one of the toughest things in public health to carry out. To finding out the worth of any program, we need experts. We need a kind of a evaluation. But so how can we involve people carrying out evaluation, not just be a respondent in evaluation process? How can we do about all these things? And are they really, do they really work if you use them? These are the questions for you people to think and practice as you go further in that way. Any response from your side on that? So how can we needs assessment? I think you people have given me enough examples on it, and I'm convinced that you know about it, and partly plan also. But I would like to hear from you some experiences about involving people in monitoring and evaluation. Can you give me some examples on it? Yes.
Dr. Mohammed Maruf and Dr. Tabassum Nawab say for needs assessment, we can opt for focus group discussion. We have received those two responses by far.
Okay. And any example for monitoring and evaluation?
So for monitoring and evaluation, Dr. Tabassum Nawab has suggested that Rogi Kalyan Samiti is an example, and Dr. Gaurika Saxena says time-to-time surveillance can be done.
Thank you.
Dr.
Wonderful.
Mohammed Maruf says monitoring can be done.
Okay.
So I think he's yet to complete the statement, so I'll wait for his response. Dr. Rivu Basu suggests social audit in VHND meetings, and Dr. Maruf suggests For monitoring, we can opt for Mahila Arogya Samiti. That can be a good example for monitoring.
Yeah, that's it. And we need to be a little more deep in that. And your examples are really excellent examples, and you are hitting exactly at the right point where we can do these things. I will just tell you some tools, but I'm not going to enlist technical know-how of each tool, and I expect you to read it yourself, but let's see some point on it. Thank you for your responses. Now, there are some tools in PRA. So PRA practitioners, rather the credit goes to Rapid Rural Appraisal, RRA practitioners. They have already developed lots of tools. Just read those tools and use those tools in your project at different phases, because it's a process. PRA is just not a one-time data collection process, a one-time data collection activity, but it's a process. And when you take certain things to the process, you have to use the battery of methods which are well sequenced and which are implemented over a longer period of time. Okay, that line may look a little technically heavy, but let me try to explain it this way. Space-related PRA tools. You have social mapping. Read the technical know-how yourself. You have resource mapping. You have participatory modeling method. You have mobility map, and you have transact walk. So you can do social mapping in your project to understand the spatial distribution, to develop a rapport with the people, resource mapping to understand what are the resources available in the community. These tools can be used in the initial part of a needs assessment. Even mobility mapping to check what kind of mobilities your patients do, or the women do, or adolescent groups, adolescent girls do in your community. Do they do short distance mobility or long distance mobility? If you see the migration data in this country, you'll see that women do a lot of migration in this country than men, but they do a lot of short migration. And men do long distance migration. Women do migration with respect to their social responsibility, marriage, and other, but the men do for earning livelihood. Like that. Transact walk. Walking, take a walk with villagers. And while walking, evoke discussion with them. Ask them questions, learn from them. You remember that film in that story? Boss goes to village and asks the villagers, why do you want mango tree? This is called as reversal of learning. Learning from people, asking them what do they want. So in health education sessions, the learning is from you to people. But in PRA, we expect you also to learn from the people. Try to know why they do that thing in the way they do so. And that's the very soul of your qualitative research. We want to know why people do that thing in the way they do so. Why people think in the way they do so. Now, here is the first social map of my career near village Malwa, near Anji village, where we did the social mapping with the villagers. Sit with them. This develops a rapport. Initially, I found this activity very frustrating, boring, and I found what it's achieving, but it was actually developing a rapport with them and helping us to understand our own people in their view, right? So understanding people from their point of view is another very purpose of your qualitative research, and PRA is very close or one of the paradigm of your qualitative research. You have time-related PRA tools. So there are nearly 32 different types of tools and techniques that you have. So as a space-related, time-related PRA tools, such as timeline, trend analysis, how situations change over the period of time. And I have done trend analysis with village women, and I found they are very, very well They are very good in telling how the circumstances are changing in society over the period of time. What their grandmothers used to do, what they do, and what they expect their daughters to do in the future. You have seasonal diagram, how the seasonality of illness changes with time. You have daily activity schedule from morning till evening. And this daily activity schedule, if you do with the villagers, the beginning, you will come to know which month and what time they are free so that you can plan your activities with them. So use these techniques, not just for data collection at random, but logically sequence this method so that you can use this information for your project planning. And tell them that you are collecting this information for this purpose. In social change process, all data is collected not just for writing an academic paper or presenting a poster in conference, but that may be done for really making change in people's living conditions. Remember, that's the purpose of carrying out research, right? So you can think in that way when you are practicing PRA. You can do a dream map. Where do you want to see yourself 10 years from now? What dreams do you have? And if you know the thing called Appreciative Inquiry, which is coming up IDM, this says that the Dinah Whitney in her very important and very nice book says that words create world. What dreams you see today comes true. And so Dream Map helps you to understand what kind of aspirations your community members have for them. And you will see that many of the time villagers fail to see dreams for themselves sometimes. And then that is your role as a facilitator to help them to visualize their future and what else they would like to see in that future. Because unless they have a clear picture of their future, they won't be taking steps in their present today. Now, these are some of the diagrams I'm taking from my work when we did work at Anji, and my social workers did it actually. And we just took photographs of it and seized those moments, and we still cherish that memory. So how we did a Venn diagram with the people, how we did a seasonal diagram with them, how we did a prioritization, and how we use this information in planning, in developing village health plan, and how we use this battery of methods or the other. You have another set of PRA tools, such as Venn diagram, your pairwise ranking method to do a kind of a prioritization, matrix scoring and ranking method, force field analysis, which I have used extensively, not only in public health, but even in educational research. You have spider diagram, which we have used extensively for monitoring our own activities and monitoring activities in the villages. Easy to understand. So please read the technical steps of it. In 3 hours, I won't be able to elaborate on them here, but I'm just telling you the potential of these techniques in that. So spider diagram, web diagram is a very potential monitoring tool. And that's why I was asking you a question about spider diagram. And participatory modeling is a very good planning tool, body mapping, to evoke discussion on sensitive issues on that. This photograph was clicked at Anji Center. The old building is demolished now. It's no longer there. But now this photograph was clicked in the lecture hall. And initially I thought this PRA, this force field analysis is happening on a topic called why farmers commit suicide in rural Vidarbha. What are the for and against forces for it? And initially I thought that villagers won't be able to think about it so detail because they are not educated people. And this education was actually creating a lot of bias and prejudice in me for rural people. And when this activity started, I decided to play the role of facilitator and come out of this group and allow the people to do the analysis of their own situation. I could see that they could do that. I just explained them the rules for running the force field analysis and they could do that thing. So based on my personal experience, if you go for a relaxed rapport building with the people, if you trust in them, and if they trust in you, and if you give them enough time to analyze their situation, provided you don't go in a rush through mode, they can analyze their situation very well, right? And so that's the thing. I mean, you can do that, and you can read these techniques and start using this not only for research purpose, but for your day-to-day management in field activities. Start practicing it, and you will come to know they work. And if they don't work for you, don't use them, right? So here comes, so how they come. Let's understand a little bit about it, because I'm going to take you to the principles of PRA and discoveries of PRA on that. So they come from 4 major sources: activist participatory research, agroecosystem analysis, applied anthropology, field research on farming, and rapid rural appraisal, RRA. So all these 5 come together and they form a PRA. Now that is something interesting here. So it has a very cocktail, multiple sources, a kind of a remix approach. Plenty of things are coming together to form a strategy. Now let's see each one of them carefully and see what we learn from them. And I say that we have to apply all those things in our PRA project that we plan. At least we have to make an effort for that. So first is activist participatory research gave us 4 lessons. It says people are creative and capable. If you see that film, whose reality, which we had shown you, believes in people's creativity and capacity. They can do situation analysis and planning. In that film, boss allows people to do the situation analysis and planning. And whatever little experience I have learned that they have a capacity, provided you develop a rapport with them. Now it's your turn to experiment it, whether it works for you or not. Third thing you have to keep in mind, outsiders have a role of facilitator. You are just going to stimulate their thinking and help them to do the process in the right way, but you are not going to impose your ideas on them, which should be empowered. 4 points from activist participatory research. So what do we learn from applied anthropology? I say that go for unhurried participation. Value field residence. Take a stand of ethnographer. Don't go to field for few hours. You go for some time and then you say, no, I have something to do later. So then you rush back to your department. Make a plan that you stay there. You participate in their festivals and you be part of them for some time. So you understand them better. Always be aware of epic distinctions. Means what you want and what they want. Value indigenous technical knowledge. Whenever people say their own ways of doing things, learn about it. How they manage COVID infection. You may make fun of their traditional treatment, but they might have discovered a lot of things by this time. So how do they do that? How do they think that it is caused? And what do they do for it? That is called as indigenous technical knowledge. And they may be having a variety of ways of treating pneumonia, diarrhea, common illnesses. And that's what you are going to learn from them when you go for it. Now question comes here, and you have to write down your response in chat box. Whose experiential learning matters? Researchers or participants in PRA? Write down in chat box. Experiential learning means planning, monitoring, evaluation, and then again planning, evaluation. So is it researchers or participants? Whose reality or whose experiential learning matters here? Write down in chat box.
So we have a few responses. Dr. Sivapriya and Dr. Aishwarya Lakshmi, as well as Dr. Mohammad Maruf, suggest that it is the participants whose learning matters. And Dr. Jidesh suggests that both matter. the learning of the participants as well as that of the researcher will matter. Dr. Anil Koparkar suggests that learning of both would matter, but more of participants. Dr. Priyasha Panda suggests it is participants, whereas Dr. Yedu and Dr. Nellikal suggest that learnings of both will matter.
Right. You as a researcher are also going to learn, and I would say unlearn many things that we learn in our universities and what our education teaches us. So we don't need to learn anything. We need to unlearn when you work with the people and you go with them and with the flow. So in a way, I agree that the experiential learning of both matters for participants to learn and for researchers to unlearn. And the more focus has to be on participants' experiential learning cycle, that whatever program you are planning, think of that what will happen if people go through this cycle. Excellent. So in a way, this is a small table which differentiate between rapid rural appraisal and participatory rural appraisal. So rapid rural appraisal came in 1970s and 80s. Objective was learning of outsiders. They were more method focused with the same tools. Just like a survey researcher, their focus was extraction of information for people for writing projects and publications. And participants were seen as respondent and researchers were seen as investigator. Nothing changed. Only there was a focus on collecting information in a qualitative way using some tools. But in 1980s and 90s, the focus changed and it became PRA, Participatory Rural Appraisal. So the objective was empowerment of people. That's what we were discussing. The focus was on behavior of researchers so that they allow people to come forward and take a lead. There was a focus on sharing and empowerment. Researcher was seen as a facilitator and participants were seen as actors. Not somebody who will supply you information, but the one who acts as an actor. In Western countries, when you do PRA or PAR type of research, your participants are also given authorship because the learning and the knowledge building is happening together. So how can only the researcher write a paper on it? People also have a share in it. So that thought is also coming up, that's growing up. And the focus is on sustainable change and not just writing academic papers, posters, but we want to see the change in community as a result of that particular project. Now, there is a shift in principles from RRA to PRA. And that was one is reversal of learning. Learn from the people. Go there to learn from them. And think of it. I have an example for that. While we were doing focus group discussion with rural youths in rural Wardha, we were actually trying to convince them that you should not consume tobacco and other things. But when they developed trust in us, when there was enough rapport building, they started telling us that how tobacco is useful for several things, such as that eating tobacco can be good for your teeth, it can take care of your toothache, can be good for pain during menstruation, it can help you to induce vomiting when somebody consumes poison, and it can help you to reduce the effect of snake and scorpion poison, and so on. We were learning this indigenous technical knowledge from them. So there was a reversal of learning because we were understanding them. What do they think about it? Because without understanding what they think about it, you cannot plan a change that is required. You can't negotiate and think about it on them. Progressive learning, be flexible to change your strategy because you may have a nice blueprint in your hand. But when you go to community, the circumstances there will force you to make certain changes and be ready for it. And you should be lucky enough to have that flexibility. And third is offsetting your biases. My rural development tool is be relaxed. Don't go for short-term visits to the field. Don't rush. Listen. Do not lecture. If you get something to listen from them which you don't want to hear, don't get panic. Just allow that information to come in. Don't react to it spontaneously. And have some good probings. This is what we have to learn. I learned these things from my social workers when I was working with them, because my MD community medicine position and my education actually made me more egocentric. So that's what we say, learning from others. And my social workers, particularly Mr. Nitin Jaishwal, with whom I worked, had enough courage to correct my behaviors, my practices, and he made me unlearn many things, that people are not just to give you information. We used to get angry if they don't provide us the correct information. And he used to say that they have a right not to tell you that thing unless they trust you. Would you give information to someone whom you don't trust? So that kind of understanding, negotiation, and changing your attitude and behavior is important as a PRA practitioner. That's what I want to say here. While doing field work, you may get some information which may not be very important or worth for you. So just be tolerant to that and stop inquiring more on that, something which you don't need. Don't just trust on one source of information, but try to collect information from multiple sources. And this principle of triangulation we use in pure qualitative research and even in mixed method research when we do program evaluation. Seek for diversity. Don't listen to, we have a problem of selective hearing. We want to hear only those things which you like to hear. And that's a problem. We have to look for diversity when new information comes. Remember, we play the role of facilitator. Be self-critical of your practice. Just in this workshop, I'm trying to show you how critical I am about my background, how critical I am about for being labeled as some expert or something, or at least I would say reflective about it. I'm consciously aware of it, that this can be the source of ego for me. And I have to be aware of it because it can interfere with me and with my participants' relations. So that is what we call it. As you ask your colleagues that in meeting, if you think if you're speaking too much to people and you're not allowing them to speak, that just comes from behind and tap my shoulder, and that gives me a feedback that I'm speaking too much, right? And that's the thing that we have to be in. Sharing, visual sharing. Whenever you do PRA exercise, the information, the exercises are done on ground. So there is a kind of visual sharing. So there are some important discoveries of PRA. Villagers have knowledge and capacity. This is a summary of discussion that we had, and you already have mentioned this point. Go for relaxed rapport building. Develop it by participating in their festivals. Develop it by doing some activities with them before you actually start data collection. Use diagramming and visual sharing. If you know all these PRA techniques that I showed, you can read the technical know-hows of it. In that, the focus is on visual sharing. The information is co-constructed between researcher and research. And now that focus is also coming in new branch called as graphic medicine. And they say that whatever discussion happens between doctor and patient, can we visualize that discussion by drawing some diagrams or something? Sequence method one after another. Just don't collect all information at the same time. Collect information using 1 to on it, raise new questions based on that, and then select next tool based on that question, and then go ahead. This way you will achieve in-depth information. Make sure that your team members are trained, your social workers, and you yourself should be trained in PRA philosophy. Now, I'm sharing and spread. This is how the typical diagramming, and visual sharing. Speak the language which they understand. Right? Now we come to the part participatory action research. It's actually continuation of that thing. So here the focus is on participation that is there in PRA otherwise, but the focus is on change action, that whatever things that you have identified, have you taken any action on it? You use the same battery of methods for that also. But here you simultaneously initiate actions, ask them solutions, negotiate on those solutions, and implement them. So now this is the definition of participatory action research. It's a long definition. So I asked Mudita to read it for us.
Sure, sir. Participatory action research. It's an approach to understand and change the social reality of world through collective, self-reflective inquiry between researcher and participants, leading to a change and empowering the people to have more control over their situation.
Yeah, it's wonderful definition. And it says that understand, make a change, and empower the people to have more control over their situation. Rather, you control them. They have control over the situation. So, in part textbook, this is written that the process designed to create conditions of economic and social progress for full community with its active participation and fullest reliance upon the community. So this is what the community development. But we remain far from this definition even today. What do you think? What's the reason? And this is the last question I'm asking. That we have such a wonderful holistic definitions of everything, but we remain far away from it. So based on the knowledge that you acquired or reorganization of knowledge that took place during this discussion, what do you think is the key that we are missing in community development? Write down in chat box, just in 1 or 2 words. What is that missing? Any response?
No, sir. None yet. I'm waiting for the responses. The moment I receive those responses, I'll let you know.
Okay.
So we have received 2 responses. One is from Dr. Nillikal. She suggests to understand the ground level problems, interaction with beneficiaries. This is one of the reasons why we still lack. Dr. Ronanki Monica suggests that the lack may be because of fullest reliance on community.
Yeah, that's it. And we also lack political will. We also lack community participation. So many things are there. So we have a long way to go to make this community development a reality. And one of the promising option is participatory action research, so that we can take small projects in the given context. Points to remember: think of whose action experience learning cycle matters. There is a thing called Kolb's experiential learning cycle. Plan, act, observe, and reflect. But this can be applied even for rural people, and they actually go through it. And when you plan a project, you have to make a plan what kind of experiences your villagers will go through when you take them through the action. And yes, as I told you, apart from rural people, it can be applicable for other settings such as hospitals or education sector. So this is participatory action, and research. So this is how they will overlap with each other and will help you to build new knowledge and documented lessons for it. Now, there are different types of participation when you think of it. One is passive participation. People just come to listen to your lecture, or they come to give information. They may come to give you a consultation. You may give them some incentives to do some task, or they may do some functions for you, or they may be some kind of a joint analysis, or they may come as a volunteer. Think of what type of participations you have. Make sure that whatever strategy you use, they should have an active role in it when they go for it. So there are some projects. I would request you to read more about that. But I have seen Clicks in Varga as an example. To a large extent. Ashram School Health Project that we did. Then another project, the Community Managed Palliative Care Program in Kerala. And a school health project in Yelagiri Hills is a perfect example of PR, and that project is still going on. It started only in 2 schools, and that schools have undergone tremendous transformation. And we started it somewhere in 2015, and it is still on. There was no external funding. There was no donor-driven agenda. It was just a social action being initiated for bringing about sustainable change in those 2 schools. We have written an academic paper on it. You can read that. And this is small. There is one more Mira infant research activity in Nepal. So this was a school health project we started, and only in 2 schools. And I say that whenever you think of PRA, don't think of big community, big problem to solve. You may be having small problems around you, small community around you. Take a lead on it. Right? And you don't need to worry about resources. Whatever you have in your hand, you work on it. Whatever power to act you have, you use that power and you go ahead with it. So don't expect big positions, power, money, and funding to carry out PRA. You can make a change in a little world that you have around you through PRA. And that is what the final lesson I want to give to you here, that you can do it with whatever resources you have around you. This project we are running without any external funding, right? And it's still on. And if you want to know more about this project, write a mail to me and I will connect you to this facilitator who started this project long time back. Now, last slide. I think, Mudita, I'm keeping my time and there are 4 minutes left. And I want people to join their lunch on time. They may be having another session to attend in the afternoon. These are FAQs. People ask this question. 1. If I use rapid rural appraisal, RRA, sorry, or PRA, participatory rural appraisal tool, for qualitative data collection in my thesis or other, then is it a PAR? What will be your answer in chat box? Write down. I use the techniques which I just mentioned for data collection. Will you call this as a PAR? This is the test for you.
So we are receiving a few responses. Mohammed Maruf, Tabassum Nawab, and Dr. Jhansi suggest that we cannot count them as a PAR method. However, Dr. Nilakal and Dr. Sivapriya, they both suggest that we can count them as PAR.
Okay. My answer to this is that you cannot call this as PAR, participatory action research, because there is no action component in it, right? So you can simply call it as a rapid rural appraisal using those techniques, or participatory rural appraisal using those techniques, depending on how you use them. Next question. Is it a new approach? Community participation, is it a new approach? The answer is no, it's not a new approach. I have already quoted references. It's quite old. But seeing it from a research perspective, from philosophical assumption perspective, seems little new. Can I modify these methods which I have enlisted to suit to my research question? Write down your answer, yes or no.
We have received a response from Dr. Mohammad Maroof. He says, as also Dr. Jitesh Kuvatada, both of them agree that they can modify those methods.
Perfect. You can modify, provided you don't touch the philosophical assumptions of the methods that you are using. Next question. In reality, who gets the priority? Means donors or research participants? I mean, researcher or research participant? Who get the priority in reality, in current situation?
So we have received a response. Dr. Mohammad Maroof says that it is participants who get the priority, whereas Dr. Jitesh suggests that researchers get the priority in reality.
Yeah.
Even
in
Dr.
reality,
Nelikan.
even in PAR, in reality, most of the time they run on donor-driven agendas, and researchers have a dominance, and we have a lot of things to learn in that to go further. PAR reduces the distance between researcher and research. Is it good or not good? Is it good? Yes or no? Yes, it's good. It helps you to access their thought construct. But just be aware that you have to draw the line between researcher and researched sometimes. So not to get too much personally involved with your participants when you go for it. And that's the line I'm trying to say, that you have to draw the line between the two that way. In what ways PAR helps in sustainable social change? What will it do? What's that key word that we have been learning? I just want to check whether you remember or not. Write down in chat box. And that's the last question. And then we close. It's 1 o'clock.
So Dr. Tabassum Nawab has suggested an answer. She says that since there is community ownership, it will help us in sustainable social change.
Right, perfect. So there is an empowerment at the same time. There's a ownership. Yes, Dr. Jansi has written empowerment, ownership, and the sustainability. So all these things looks very nice to say here. Now it's a test for you. Try to take one small project in whatever field areas you're doing and share your experience with me at my email ID. And if you need any help or assistance in whatever you are planning in future, feel free to write or contact me. You can take my contact details from the organizers. So finally, it's all about making positive change in the community. And in future, there's going to be a tremendous change because of digitalization. So what will be the future of PAR in digital world? And I'm not going to evoke your responses on that, but just think of it. It's going to make a tremendous change, the way things happens. And the change has already started. And do we need to modify our methods in the light of this digitalization? You think of it. And finally, last slide, I would recommend you to read this, keep these things in your collection, read them. And this presentation, which I've made, is based on this text. So you can refer to some of them. So some of the materials are freely available online to download and you can read them. So thank you very much for your patient listening and joining to this pre-conference. And before I close, if you have any question, feel free to unmute and ask a question. I can take 1 or 2 questions, maybe. Something that you want to say.
So Dr. Tabassum Nawab, yeah, during your presentation, she had asked a question. Could you please give an example of usage of body mapping? So.
All right. I say that, say for, I have not used it personally, but my ANM, she used to use it for evoking discussion on the reproductive tract parts. And so they see how people see their body parts. As a medical doctor, I see my body part in a particular way, but how do people think about their different body parts and how they perceive its utility? And that's a very sensitive tool to evoke discussion about your body. And you will get a very shocking information. I was doing one exercise with adolescent boys, and we didn't use exactly a body part, but we were discussing about body parts. And the boys said that one of the boy mentioned in the discussion that I get sexual feelings in me, and is there any tablet for it? And we were surprised with this, that do you have a guilt about having that feeling? And he said, yes, because my teachers and my parents said that it's a bad thing to have it. So is there a tablet for it? And so he was referring to his body part on that. And so this kind of discussion can happen by using this body mapping technique. And so your perception about your body part and community's perception about body part will be different. So read about the technical steps about doing body mapping. Okay, any other question? Okay, so thank you very much for your patient listening. And it was wonderful facilitating you people. And
Thank you
I
so much,
mean,
sir.
I have, yeah,
So
I have
your email ID,
undergone.
please, sir.
Where is my email ID? Okay. I
So
don't know
I
how
have
to write in chat
repeated
box.
this time and again, so I'm asking.
So I'll be sharing your
Great.
email ID in the WhatsApp group as well and in the chat box as well with everyone.
Yeah, I have written that. But do not forget R in the email ID, because amoldogre@gmail.com is a lawyer, and he often writes to me complaining that a lot of mails go to him, and this is my mobile number. 43608. And I had to undergo nearly a 2-week long training in PRA to understand what it is. And I really find it challenging to express everything to you in 3 hours, but you people have been very tolerant and kind enough to be patient when the session was on. And thank you very much. So I thank you, Mendeles, sir. And we tried to contact you, sir, and wish you happy birthday. But we could not hear your voice from your side. And I thank all the organizers for inviting me to speak on this topic. Thank you all. Thank you very much.
Thank you, sir. We are very grateful to you for sparing so much of time and sharing this extensive knowledge with us. Definitely, we have something big to take back from this lecture. I'm extremely grateful to you for sharing such informative lectures. Even the video that you shared, it was it created a very good understanding in our minds. So we are really thankful to you for that, sir. Again, I thank Dr. Mahadalissa sir for our MMC observer for this workshop, for being here. And I also would like to thank all the delegates for being so patient, and without any difficulty, we were able to go forth with the entire workshop. So I really would like to thank all the participants again for this. I request you now to kindly please switch on your videos for a little while so that we can complete the documentation. So I would not take much of your time, just a little bit. I'll just click a few screenshots and I think we'll be done. All right. Thank you everyone for the active participation. Thank you so much, sir. I'd like to thank all the participants again. I think
thank you
to the session.
Thank you to Chetna, madam. I didn't know that madam is there. I thought she left for the exam. Thank you, madam. Thank you.
Thank you, sir.
Thank
you, sir.
All the participants who have participated in the second workshop. It is
So
scheduled
shall
at
I exit? Yeah. Shall I exit from
Yes,
the
sir.
meeting, Dr. Mudita? Thank you very much. Thank you
Yes.
for your support.
Thank you so
I'm
much, sir.
leaving. Bye.
Thank you, sir. Bye, sir. So for all the participants who will be interested to join the second meeting and who all have received the link for the second workshop, it starts at 2 p.m. Right? You would have already received a link on your WhatsApp group. Thank you once again. And kindly please make sure that you fill in the feedback form. It is important for documentation reasons. Thank you, everyone.
Thank you, Mudita, for hosting it wonderfully and without any glitches. You managed it very well. Thank you for that.
Thank you, sir.